I know some of you are watching anxiously, waiting for news, desperate to hear that your mother or father or husband or wife is still alive in their long-term care home. You're not allowed to visit, even phone calls are of limited use, especially if your loved one is nonverbal or has dementia. I get it. My parents spent their final days in a care home, and as harsh as it sounds, I'm relieved they passed away before this pandemic hit. Because it is inside these long-term care homes that this coronavirus is taking hold and taking lives. Half the deaths from COVID-19 in Canada are in care homes. And in the most grim cases, people are left to die alone in their beds. And it's not like there were no warnings. The families dread the distance. When all they want is to be inside, holding a hand, all they can do is keep vigil outside.
4th floor, 4th window across, right up there.
Anything to catch sight of those dear to them, now isolated inside. Any precious sign they're okay.
She's alive and kicking. That's what counts.
Like a wildfire, the coronavirus has blazed through Canada's long-term care homes, exposing cracks and faults in the system from coast to coast to coast. There are now outbreaks in more than 600 facilities, accounting for nearly half the deaths from COVID-19 in Canada, including the very first.
We unfortunately have had a death here in British Columbia.
It happened here at the Lynn Valley Care Centre in North Vancouver. And it was here, too, that a healthcare worker, a woman in her 50s, became Canada's first reported case of community transmission, a troubling sign the virus had taken hold among our most vulnerable. Public health officials rushed to trace her contacts and tried to contain the spread, but those who knew best feared the worst.
If you have people in your gathering who are elderly, who are more and I just know how stressful it is for our healthcare system, for my colleagues, and for families.
And then the pattern began to repeat elsewhere. At a small nursing home in Bobcaygeon, Ontario, nearly half the residents died in their beds, and at least 28 staff have tested positive.
It's a fantastic community, and to see this happening is heartbreaking. It's heartbreaking.
Soon, there were multiple outbreaks in care homes across the country, most with a common story. A sudden onslaught of cases, sometimes dozens of dead, testing and detection falling woefully behind the wave. Caregivers sick and off work, those remaining struggling to keep up in homes that were often chronically understaffed before this pandemic. Residents sharing rooms and bathrooms, staff lacking personal protective equipment, ideal conditions for a virus to run rampant.
Go in the bedroom, okay? The bedroom? Mm-hmm.
Those on the front lines are mostly women, new immigrants, and visible minorities, doing difficult, deeply personal work for low pay. Bathing, feeding, changing adult diapers, it can be exhausting physically and emotionally, and they often work part-time in multiple facilities to make ends meet.
It remains at a critical low. We really need skilled workers.
In some care homes, there's been a collapse in frontline staffing. Some sick, some staying away because the risk is too high.
In my workplace, we all drop like flies. You have no idea how fast it infects everybody.
It's extremely hard for us because you grow attached to them. You don't want to refuse, but obviously a lot of people are going to feel unsafe.
Now hundreds of homes are locked down, leaving families worried sick, agonizing at the unthinkable, loved ones left alone in their final hours.
Here I finally get in. My father's on his last breath, literally dead, lying in his bed. So I went for 3 weeks thinking my father was fine. He's not. He's dead.
And there's the harrowing accounts of what happened inside Montreal's residence Heron. The conditions beyond words. Those who were still alive were dehydrated and malnourished and hadn't been bathed or changed in days.
Somewhere along the way, there had to be somebody to step in, a flare sent up.
Most staff had left. A doctor arrived on the scene so desperate, she called her own husband and teenage children to come and help. 31 residents died in 3 weeks. The government seized control of the facility, and the Premier asked for help from the military. For a nation, it's a defining, shameful moment, exposing how we treat our elders. Our elders, he says, struggled to leave us a rich and just society, a beautiful society, he says. We have a duty to protect them. The fact is, our long-term care system is built on a crumbling foundation. This pandemic has laid bare long-standing issues that, until now, we've chosen to largely ignore. Dr. Samir Sinha is an advocate for the needs of older adults. He's Director of Geriatrics at Mount Sinai and the University Health Network Hospitals in Toronto and architect of Ontario's seniors strategy. Dr. Sinha, first, do you think we have a full and accurate picture of the scale of outbreaks in care homes and retirement homes across the country, or have cases been underreported?
I don't think we have the accurate picture that we actually need right now about how things are progressing across the country. And that's for a bunch of reasons. Right now that some of the ministries, for example, have data streams and public health units have data streams looking at certain types of homes like nursing homes, but not necessarily retirement homes. So the official numbers that you see coming out in Ontario really only include nursing homes, but don't actually include retirement homes that are equally just as vulnerable and actually are more numerous than the retirement homes we have. So right now, the numbers you're seeing that really are over 1,000 homes across the country that are affected don't really give you accurate counts. And the same issues happening in the United States. And the problem with this is that if we don't have the accurate data, then you can't fight a fire blindfolded.
You know, what is the biggest failing, do you think, of our care home system that has allowed this virus to take hold with such ferocity?
I think the biggest issue that's really come to forward at this moment has really been the issue about the way we staff our homes. So, for example, many homes across the country, they don't usually offer nurses and personal support workers who work in them the same wage rates that they would get working in a hospital. So it's no surprise that the majority of homes across the country tell us that they actually have trouble recruiting people to work in these environments, and then they have trouble actually retaining them, because often when a job opens up at a hospital, that often pays a better wage rate with benefits like pensions or sick benefits or sick days, for example, that people will jump ship and go there. So we have a real unstable staffing situation.
You know, the shortage of staff, the low pay, the fact staff work in more than one care home, none of that is new. All of it contributed to the spread. Why weren't those faults in the system addressed long ago?
You know, some folks are pointing back to the SARS Commission of 2004 that really focused on the issue that that staff working between multiple homes or in multiple settings was one of the reasons why SARS as a coronavirus was spreading between institutions and facilities. And so it's something that was recommended way back then that we actually eliminate that practice. So former health ministers at the time who said, wait a minute, we made this recommendation back in 2004. Why did we never act on it? That's a great question, because now we're actually seeing that while it wasn't such an issue in the last number of years, because we didn't actually address that comprehensively, people have now been paying for it with their lives.
You know, I know from firsthand experience with my own parents that care home workers are like angels. They work so hard. They do incredibly difficult work. They do it with love and patience. Why don't we as a society value them more, pay them more? And do you think we will after this?
I think we have to. I think this is a massive wake-up call that as we age as a society, we're going to need more homes like these in the future. We should actually treat these workers, I'm not saying better than, but I'm saying at least equal to the way we actually respect and treat our workers in hospitals, because these workers are dealing with some of the sickest and most frailest people in our country. And frankly, when we don't treat them well, we all pay the consequences as a society, and these individuals with their lives as well.
You know, we've heard from people who say, I want to get my mom or my dad out of there. I'm so worried about them. I can't see them. What's your advice for people? Would you remove your parent from a care home right now?
If I was in BC and Alberta, I'd say I think they're getting things under control, and I think we need to make sure we can support our homes to support our loved ones well. But I'm nervous about people who have loved ones in care in Ontario and Quebec right now. And for those families who are thinking, well, we could possibly bring our loved ones home. The Ontario government back on March 24th actually changed the regulations to support families to do this if this was the right decision for them.
You've spent your career in the field of geriatrics, looking at aging and how to help the most vulnerable people in our society. When you look at what's happening in care homes in so many places in this country, what's your gut feeling to watch this unfolding?
It honestly, it's left me in tears at times. Because, I've dedicated my life to supporting older Canadians and enabling them. And when I think about, the 400,000 vulnerable Canadians across these homes, and the fact that we as a country, in many ways, have let so many families and so many individuals down, it tells me that we should have been doing better and that we can do better and we have to do better.